A very good morning to you and welcome to the first Africa Conference on Tobacco Control and Development. And I'm so thrilled that we are finally here, everyone, after months and months and months of preparation and planning. As we all know, this is quite a significant moment in Africa where the first tobacco control conference is being hosted by tobacco control actors on the continent. And there are quite a few of them. And I can say I am honored and I feel so privileged to be part of this particular conference, being the first one ever held for Africa. And I think it really is going to bring about some wonderful, much needed change that we need on the continent as well. I'm Yuveka Rangappa. I am your English host for the next 3 days. You are stuck with me. We're going to become best friends. So let's pop on over to London, where we say bonjour. Yes, you heard right. We say bonjour to the lovely Anne-Marie. And I want to find out from you, Anne-Marie, bonjour. You've sent the London weather over here to Johannesburg. It is miserable out there. So I wonder if it's sunny outside your window there.
Bonjour Uveka. Well, you know, these are 3 days for sharing, so I'm just sharing a little bit of my experience. Bonjour à tous, je m'appelle Anne-Marie Diaz-Borges et je suis, comme l'a dit Uveka, votre modératrice pour le français durant ces 3 jours de travail et de réflexion autour de cette thématique si importante, la lutte contre le tabagisme sur le continent. Et avant d'entrer dans le vif du sujet, quelques consignes pour vous, mesdames et messieurs. Alors, sachez qu'un service de traduction simultanée est à votre disposition. Alors, pour y accéder, il suffit de cliquer sur l'onglet anglais supplémentaire ou bien More Tab en anglais et de choisir l'onglet traduction.
Well, I don't know what you just said there, but yes, I will marry you, Anne-Marie. I will come to London and I will marry you. That sounded fabulous. You're going to have to teach me French when we're done with all of this, with the conference over the next few days. Yes, please. Yes, my children speak it. I'm hopeless. They just taught me bonjour before I left home this morning. Well, for those of you needing French to English translation like me, well, you can also do the same. Click on the screen under the More tab, and there you can select interpretation for yourself.
Votre avis nous intéresse. Sachez que cette conférence est aussi la vôtre. Alors, n'hésitez surtout pas à nous partager vos commentaires dans l'onglet discussion ou alors vos questions dans l'onglet questions et réponses. Et un membre de notre équipe prendra le soin de vous répondre soit durant cette conférence ou tout de suite après. Et puis, bien sûr, les réseaux sociaux sont très importants de nos jours. Alors, joignez-vous à la discussion online, comme on dit, en ligne, à l'aide du hashtag Tobacco Control en un seul mot.
Yes, and if you are on social media, because we know that's where great causes are fought, that's where the word is spread. Hashtag tobacco control is what you should be using to spread the news about this amazing conference and this amazing event. Now, this conference is brought to you by the Center for Tobacco Control in Africa in conjunction with the Africa Capacity Development Foundation. It's being supported by partners, which include Makerere University, African Tobacco Control Alliance, ATCA, Africa Center for Tobacco Industry Monitoring and Policy Research, ATIM, Campaign for Tobacco-Free Kids Research Unit on the Economics of Excisable Products, that is a mouthful, that's REAP, R-E-E-P, Tax Justice Network Africa, the International Union Against Tuberculosis and Lung Disease, and the World Health Organization. I did tell you that there were many actors involved in this process.
Et oui, beaucoup de partenaires et puis des partenaires d'envergure. Vraiment, nous nous joignons les mains tous ensemble pour faire avancer notre magnifique continent et il le mérite. Alors, nous serons également en compagnie d'une impressionnante brochette d'experts qui partageront avec nous leurs conseils et bien sûr leurs éclairages sur la thématique du jour. Alors, ils sont Dr Adriana Blanco-Marquizzo, qui est la chef du secrétariat de la Convention cadre de l'OMS. Dr Blanco-Marquizzo a été au cœur de la lutte, il faut le savoir, anti-tabac dans son pays, le beau Paraguay, qui est d'ailleurs devenu le tout premier pays sans fumée de la région Amérique. Également, Dr William Maina, qui est le responsable du programme anti-tabac à l'OMS Afro. Dr Maina cumule plus de 20 ans d'expérience dans la gestion des services de santé, notamment au Kenya. C'est assez impressionnant quand même, hein. Et au Kenya, il a notamment été instrumental dans la mise en place de programmes de santé publique. Alors, parmi nos illustres panélistes, également Dr Margaret Agama Agnete, qui est directrice de la division santé-nutrition et population de l'Union africaine. Dr Agamagne possède une vaste expérience dans l'accompagnement des populations marginalisées et vulnérables, c'est très important, et on parle ici bien entendu des femmes et des enfants. Et au cours des 30 dernières années, elle a occupé plusieurs postes de direction, comme par exemple au sein des Nations Unies. Et puis enfin, nous avons l'honneur d'être en compagnie aujourd'hui du docteur Ahmed Ogwel Ouma, directeur adjoint des Centres africains de contrôle et de prévention des maladies, un organe de l'Union africaine qui a pour objectif de promouvoir la prévention et le contrôle des maladies en Afrique. Alors, le docteur Ogwel Ouma a été un des pionniers dans la mise en œuvre de la Convention cadre de l'OMS et de plusieurs autres instruments de prévention ainsi que le contrôle des MNT, ce sont les maladies non transmissibles. Alors, nos illustres invités aujourd'hui partageront dans environ 1 heure leur expertise au cours de notre séance plénière.
Well, before we get to the meat and the nitty-gritty of all of those very, very important discussions, Anne-Marie, I think it's time that we actually just head on over for a few opening remarks. And let's start off with the welcome remarks from the conference. And here we call upon the chair, Professor William Bazeo. Let me just tell you a little bit about the prof in case you don't know too much about him. He's a Ugandan physician, public health specialist, academic researcher, and academic administrator. And since September 2017, he's been the Deputy Vice Chancellor in charge of finance and administration at Makerere University. Prof, over to you.
Thank you very much. Our MCs, it's great listening to you. And good morning, good afternoon, good evening, wherever you are, listening and watching us. Your Excellencies, distinguished delegates, ladies and gentlemen. Before I make my welcome remarks, I want to first congratulate Africa for celebrating 10 years since we established this center. And this center is now, as it celebrates 10 years, we are hosting the first ever Africa Tobacco Control Conference on tobacco and development. This is a big milestone that those who started the center, those who supported us, we have now matured to actually take on business and support Africa totally. I warmly welcome our representatives from African countries, the governments, WHO, development partners, as you heard them being mentioned, regional blocs, civil society, and the tobacco control community. The tobacco control community, you have a special role in this conference, and we are sincerely grateful. At CTCA, we developed the research agenda across the whole of Africa, which has never been there, now it is available. And from this research agenda, we have been able to develop the different themes that are carried in this conference. And the stakeholders the stakeholders that have participated in the research agenda will have an opportunity to hear from the different countries where we are, what has been achieved, and where we are going, being informed by the researchers, the different communities, and those who have participated in tobacco control programs in Africa. At the Secretariat, which Secretariat is composed of the ACBF, which we are very grateful to, and CTCA, we're excited to host you and grateful for your participation in these unpredictable times of COVID. Would have loved to be together, share the meeting, and physically exchange notes and the other things. But because of what is happening, we are not. Nevertheless, it is a dream come true to us to host this conference at the peak of our 10 years to harvest or to see the achievements that we have gained over the 10 years. We have worked with the different countries, to which I sincerely want to thank the governments, those which have opened doors to CTCA to work with, and to all the partners that we have found on the road, on the way. We are indebted to our tireless partners that have funded us from the beginning since 2011, Bill and Melinda Gates Foundation, our supporters, WHO, our supporters and promoters of this center, the regional tobacco control partners, and all of you who have shaped this conference. I am certain that we are going to learn a lot from the researchers and the tobacco control actors as they give us the experiences over these 3 days of what they have seen, what they have worked on. And then on the last day, we will be able to have a communique on where we are going next, where I believe that many countries will learn from others how to go and shape tobacco control programs. Let me wish you a successful virtual conference for the next 3 days. And I once again want to welcome our chair of the board and the board members that are attending. And I welcome our ACBF Executive Director for his support, and I thank him for supporting us as we organize this conference. And lastly, I want to thank the organizers, all the different committees that have participated in organizing this conference. I am sincerely grateful to the Secretariat, those who have not slept, to make this a success. Thank you very much. And I hope and believe one day we shall have a tobacco-free Africa. Thank you very much for listening to me.
Thank you ever so much, Professor Badzeyo. C'est un véritable honneur d'être en votre compagnie aujourd'hui. Merci beaucoup. Effectivement, comme vous l'avez si bien dit, il est important de célébrer ce qui a été accompli. Alors, c'est un rêve, vous l'avez dit, qui est devenu réalité. Donc, du rêve, on est passé à la réalité et unissons-nous à présent, comme vous l'avez souligné, pour aller encore plus loin. Alors, l'illustre professeur Badzeyo, il faut le noter, il est également le doyen de la faculté de l'université de Makerere. C'est l'une des plus anciennes et prestigieuses universités de notre beau continent. Et c'est également là, il faut le savoir, que se trouve le Centre pour le contrôle du tabac en Afrique. Et nous avons à présent l'honneur d'accueillir un haut membre de cet illustre établissement. C'est le vice-chancelier de l'université de Makerere, le professeur Barnabas Namwangwe. Professeur, c'est à vous.
Ladies and gentlemen, it is a great pleasure for me to be here with you and to join hands on this crucial activity in the tobacco control response. I salute you and convey greetings from the Center for Tobacco Control in Africa and from Makerere University. I take this opportunity to recognize the remarkable efforts by the Center for Tobacco Control in Africa, African Capacity Building Foundation, the Regional Tobacco Control Partners, Bill and Melinda Gates Foundation, and the World Health Organization for making this conference happen. While we know that tobacco use has been relatively low on the African continent compared with other regions of the world, it appears to be increasing in this region. In 2015, the World Health Organization estimated tobacco use prevalence in the African region at 13.5%, compared with 20.1% in the American region. However, there has been observed reduction in tobacco use in high-income countries, but a rise in the low and middle-income countries, especially Africa, demonstrating a shift in the tobacco use burden. This conference becomes critical at this point to provide more insights to tackle the tobacco use epidemic and draw pathways for prevention, control and cessation programs, and address the main risk factor for non-communicable diseases. In a drive to expand and strengthen the evidence base and propel the gains harvested through the previous and current tobacco control efforts, this conference positions us to present the research findings that will ground our strategies and further efforts to interrogate and explore more areas in tobacco control policy and implementation. This conference provides a benchmark to set up a strong foundation for the Africa think tanks to foster tobacco control, draw avenues for information and knowledge sharing, experience building, and also provides a viable platform for the Africa research agenda to drive us to our vision of a tobacco-free Africa. The objectives of the conference include the following. 1, to disseminate recent evidence on tobacco use and its impacts to inform tobacco control policy designs and implementation. 2, to collect research-based recommendations that will stimulate continued research to foster prevention and control of the tobacco use. 3, to enhance networking and collaborations among tobacco control researchers, advocates, policymakers, implementers, and other actors. Focusing on the journey and targeting at a horizon, the conference marks one of the milestones to evaluation of progress in tobacco control policy and strategic development to impact on tobacco use and the attendant negative outcomes in the African region. To achieve and maintain research, there is a greater need to build a strong domestic multi-skilled human resource to conduct and sustain research, including translation into tangible actions. This can well be attained through promoting operational research to inform policy, implementation science approach to provide evidence on feasibility of approach, process, and results, working with African training institutions to identify and support students at mid-level and advanced training and fellowships to conduct research and disseminate the findings for policy and strategic action. This could strategically maximize knowledge transfer between high-income and low-income countries through twinning of training institutions, but also through applied research. While 87% of countries in Africa have signed and ratified the World Health Organization Framework Convention for Tobacco Control, countries are at varying levels of its implementation, and the implementation of most tobacco control measures remain inadequate or incomplete. This creates greater reason for this conference to simulate more research to explore the low rates of implementation of tobacco control measures. To realize greater impact of tobacco control, rates of tobacco cessation will need to increase to significantly reduce the health consequences of tobacco use in the short and mid-term. Currently, demand for cessation support exists in Africa, though most African countries have limited prioritization of tobacco control efforts in their national agenda, and the focus on research by these countries is even dimmer. Through our work across Africa, we observe most, if not all, of the population-based research is done by our close friends, the technical partners, and this data is not readily disaggregated by in-country geography and population segments, making it difficult to inform context-specific policies. And tobacco control research is clustered around a few countries, based most of it externally conceptualized, supported and implemented, thus need to strengthen domestic research efforts in Africa. It is imperative, therefore, that we put our thoughts and efforts together to promote and sustain tobacco control research, institutionalize information sharing feedback, and dissemination to inform policy and strategy for tobacco control in Africa. This conference is timely. For tracking of research progress and evolution of evidence, we need a consensus that this conference be held every 3 to 4 years. We have achieved a lot as tobacco control community. We can achieve even more as tobacco control research community. We should aim to pitch our African universities to include and strengthen tobacco control training and research in the academic and community service work. Today and throughout this conference, let us reflect on the science presented and position ourselves for the ever-changing tobacco use control changing landscape. I wish you all great conference and look forward to a stronger tobacco control research and networking. Thank you for listening to me.
President Wangwe, thank you so much for that. And I think it really brings it home, especially for us ordinary folk who don't deal with policy and deal with issues like this on a day-to-day basis, is that when we think tobacco and we talk about the dangers, I think automatically we just think we have to get people to stop smoking, just stop smoking. Let's show them what a bad lung looks like. Let's show them on the, cigarette packages what this is supposed to be. But as you've just explained, it goes so much deeper than that. There is so much more to stopping the scourge than us just, I suppose, employing the shock factor and shock tactics, that it goes way deeper and into a much darker place than this, which is why I think we're so grateful. As a mom myself, with 2 children who have to live in this world, we're so grateful that the likes of you and everybody else who is part of this conference is actually taking the initiative to actually tackle the problem head on. And I do thank you and everybody else for that as well. Thank you so much for your time and for your comments this morning. Well, a few remarks now from the WHO Tobacco Free Initiative Program Director, that's Dr. Vinayak Prasad. And just to tell you a little bit about Dr. Prasad, he leads the WHO Tobacco Free Initiative and is responsible for the overall coordination of tobacco control programs at WHO HQ. Sounds like a secret spy, like a cousin of James Bond, I suppose, including liaison with the WHO regions and with the convention secretariat to the WHO FCTC. As a program manager, Dr. Prasad also coordinates WHO's national capacity building teams for tobacco control. And there's a whole list of his achievements here. But Dr. Prasad, we will let your knowledge speak for itself. The floor is yours.
Thank you. Excellencies, colleagues, delegates, participants, it's an honor to be here. And I'm just remembering the days when we started to do this work 10 years ago. And I'm seeing William and also Ahmed, champions who've been working on tobacco control in Africa. But first of all, special thanks to Professor William Bazio to have managed to get this first global conference focused on Africa with the African expertise on the ground, which was quite a dream 10 years ago. And I think that to me is a big milestone to celebrate. But let me go back a few years and see. Now, and this is just a screenshot of the Global Tobacco Control Report, GTCR, 2011 and 2021. And don't focus so much except for the blue color, the dark blue color. In 10 years, see the number of blue colors that has gone up. Blue is an indication of the highest achievement of the Empower policies, which are all the demand reduction measures from the WHO FCTC measures achieved at the highest level of its achievement. And I think that is something to celebrate. And let me tell you something. Today, we have 62 countries in the world who are on track to achieving a 30% relative reduction in prevalence. These are targets which are voluntary targets, which countries have agreed to achieve the reduce the burden of NCDs, non-communicable diseases, which tobacco is the biggest killer and contributor to. So a 30% relative reduction was considered difficult to achieve for a number of countries. Would you believe that out of the 62 countries that are on track, and another 25 very close to achieving it, there are 25 countries in Afro region today who are headed to achieve it? That's the largest share of countries on track to achieve global progress. And something for, and Adriana is of course here, to note that it's a 53% share as a region, much higher than the champion region, which is PAHO at 46%. So I think we have come a long way in the African context to see this progress happen. So some years ago, we used to always talk of the island countries having large graphic health warnings, Madagascar, Seychelles, and Mauritius. Today, we have 14 countries with large graphic health warnings, and many of them, in addition, which have warning labels, which are also equally good. We have 11 countries who have completely banned smoke-free public places, workplaces, and transport. We have 21 countries with comprehensive bans in tobacco advertising and sponsorship. So these are all good things to look at, and look at this, the ways countries have managed to move forward in the middle of other priorities for health, in the middle of situation where there are less investment. But we should thank, of course, the Bill and Melinda Gates and the Bloomberg philanthropies who have brought in investment in tobacco globally, and Bill and Melinda especially for the African context. So resources have come in, strengths have grown, we have seen countries. But what are the challenges then? Now look at those ones in red I've just put there. There are 13 countries that have done nothing in terms of banning smoking in public places. There are 9 countries that have no warning labels. There are 11 countries that have done nothing in terms of banning advertising sponsorship. And all of these countries are absolutely fertile grounds for the tobacco industry to come in and do whatever they want to. So I think it's an important message that there are countries that have moved very fast and moved well, but there are many who have not moved. So let me just, because I don't want to take away the pleasure of listening to all of the champions in the plenary session who will get into the debate and details of how we are moving and where we are making progress and where we are not. There are just some key messages to the participants. We are surely on track in the region to achieve this 25 countries, but we would really look to see 35 or 40 countries achieve the target. Now, when we are saying 30% reduction, that doesn't mean that the absolute number of smokers are going down, but you are achieving a relative reduction. It's showing that there is now more political will and there is better coordination amongst the partners and all the stakeholders. Civil society efforts have also become stronger. So, but look at the challenges. There are countries which still don't have enough resources. Compliance and enforcement are huge issues. So the gains will not come through if we don't strengthen capacity within the government. But also we must acknowledge that the progress on 2 areas in the demand reduction side, especially on taxation and cessation, is extremely poor. There are only 2 countries that have made to the level which we would recommend as WHO's recommendation on taxation. And then on cessation, there is no country. So there are a large number of smokers and tobacco users, but they're not getting the support. And then most crucial for this region, very important, is that while globally we largely focus on demand measures, this region does require looking at supply side issues. And that's an area of research and area of investment. Now, sale to minors is an important area, given that this is a young population, young continent, especially of novel and new emerging products, which is a huge problem now. We have more than 37 countries in this region who have zero control on these. So industries have got a fertile ground to keep selling whatever they want to in terms of e-cigarettes, heated tobacco products. And then important is that about 8 or 9 countries where there is a huge livelihood concern. So the balance between health and livelihood comes up. So it's a barrier to moving tobacco control. And we really would need to work closer with the agriculture and other communities to see how we can help the tobacco farmers to shift. You know, in WHO and FAO and World Food Program, for example, recently launched a project in Kenya to see a viable shift in the market. So just for more thought, look at building capacity for enforcement compliance, looking at more operational level research, because what's working, what's not working, and country settings in different contexts needs to be really looked into and brought out. And I hope this conference will bring out some of those measures and some of those lessons learned. Important to focus on institutional level strengthening, and I'm glad WHO and CTCA and other partners, ACBF and CTFK are working together to ensure that, but we need more domestic and local level partners, not just the regional and the global ones, to strengthen the institutions. And definitely need more resources. And looking at tax as a domestic resource, but other resource options must definitely be explored. Important to recognize that the health minister is key. And so how do we get that health minister's leadership is, I think, an important issue. But at the same time, recognizing that a number of actions are outside the health sector. So how do you transfer the knowledge and how do you harness the networks which don't belong to us, whether it's in the maternal child health space, environment space, or agriculture space? So what are the joined up actions which we can go forward to move this narrative in the next couple of years? And I think if this conference is able to bring out some of those, I think this will be an excellent opportunity to further look forward in scaling up tobacco control. So let me stop here and thank the organizers for inviting me on behalf of WHO Geneva to share my thoughts. Over.
Merci beaucoup, Dr Prasad. Merci énormément pour vos remarques éclairées, notamment pour avoir dressé le bilan, parce que surtout en ces temps de pandémie et face à ce combat, nous devons d'être réalistes, bien connaître ces défis, les regarder bien droit dans les yeux, mais aussi célébrer les progrès qui ont été accomplis. Et ça aussi, vous l'avez si bien fait, si bien exposé pour nous. Et en ces temps de pandémie, ça fait vraiment du bien finalement d'avoir des bonnes nouvelles. Et puis, comme vous le dites, hein, allons encore plus loin. Vous avez mentionné 25 pays qui sont en bonne voie. Essayons de passer à 35 dans les prochaines années. Merci énormément, Dr Prasad. C'était vraiment un honneur d'être en votre compagnie aujourd'hui. Alors, j'ai à présent l'honneur de céder la parole au professeur Emmanuel Nandodzié, qui est le secrétaire exécutif de la Fondation pour le renforcement des capacités en Afrique, qui est d'ailleurs le co-organisateur avec le CTCA de cette belle conférence virtuelle. Alors, le professeur Nandodzié est fort d'une expertise de plus de 20 ans dans le domaine du développement et a entre autres occupé le poste de directeur du développement économique et de la division du NEPAD à la Commission économique des Nations Unies pour l'Afrique. Professeur, c'est à vous.
Merci beaucoup, Madame la modératrice.
C'est moi qui vous remercie.
The Honorable Minister of Health of the Republic of Uganda, Dr. Jane Ruth Aseng, distinguished representative of the Health, Humanitarian Affairs, and Social Development Department of the African Union Commission, Dr. Margaret Agama Anyete, distinguished representative of the Bill and Melinda Gates Foundation, Ms. Cynthia Lewis, distinguished representative of the World Health Organization, Dr. Vinayaka Prasad, distinguished representative of development partners, the Vice Chancellor of Makerere University, Professor Barnabas Nahongwe, the conference chair, Professor William Bazeo, distinguished representatives of the regional tobacco control partners and civil society organizations, distinguished panelists and experts, members of the media, distinguished guests, ladies and gentlemen. I am honored and pleased to deliver the keynote address at this important conference on tobacco control and development, the first ever Africa Tobacco Control Conference. I would like to start by thanking you all for your commitment, financial and knowledge contribution, and hard work towards delivering Africa's tobacco control agenda. My sincere appreciation goes to the World Health Organization, the Bill and Melinda Gates Foundation, and indeed all the contributing partners for joining ACBF and the Center for Tobacco Control in Africa in organizing this conference. At the onset, I would like to highlight some data, some of which have been mentioned before, but that I personally find terrifying. I might seem like I'm preaching to the choir, but sometimes certain information needs to be repeated or reiterated. And so I personally find terrifying this information, and which underscore the rationale for organizing this conference. On a global scale, the WHO informs us in its 2021 report on global tobacco epidemic 2021 that there are almost 1 billion 1 billion tobacco smokers aged 15 years and above in the world, consuming an estimated 5.8 trillion cigarettes a year. There has only been a little change in these numbers since 2007, when there were just over 1 billion tobacco smokers. Currently, 847 million men smoke tobacco, 46 million fewer than in 2007, and 153 million women do the same. And most scary, an estimated 24 million children aged 13 to 15 around the world smoke, and 13 million smokeless tobacco, despite some countries banning sales to minors under the age of 18 years or setting an even higher age limit for tobacco purchases. So globally, tobacco use is the leading preventable cause of death among adults. And again, the WHO estimates that worldwide smoking causes about 71% of lung cancer, 42% of chronic respiratory diseases, 20% of global tuberculosis incidents, and nearly 10% of deaths due to cardiovascular diseases. In addition, secondhand smoke is responsible for the death of more than 880,000 individuals every year around the world. Honorable Minister, distinguished partners, ladies and gentlemen, in light of the global picture, of course, the main question for us today is what is happening in Africa. The burden of tobacco-related deaths in Africa increased from 150,000 reported deaths in 1990 to over 215,000 in 2016, representing about 70% increase in mortality. The highest number of deaths was recorded in East Africa, and lowest was recorded in Central Africa. As highlighted by the WHO Regional Office for Africa, in the past, the prevalence of tobacco use among girls was lower than the rate for boys. But recent studies have shown that the prevalence rate among girls, which was from 4.6% to 36.6%, has become as high as for boys, from 7.8% to 36.5%. A lot of factors will explain this, but the problem is that these trends predict that African countries may not be able to meet the goal of 30% relative reduction in tobacco as used by 2025, as the previous speaker indicated, which was identified as the key intervention for the reduction of non-communicable diseases at the 66th World Health Assembly in 2013. Honorable Minister, distinguished partners, ladies and gentlemen, the African Capacity Building Foundation, with the support of Bill and Melinda Gates Foundation, decided 7 years ago to take on the menace of tobacco use because it threatens the very availability of Africa's present and future workforce, or in other words, the capacities that we're building which is the target of the DOS in other areas of Africa's development process. Building human and institutional capacity of the key actors. Building institutional and human capacity to deliver in their mandate and be able to, better and more sustainable manner. ACBF's contribution to the fight against tobacco use also includes its endeavor to produce and share knowledge, effort of all the partners and the vision, commitment, and research provided by the key partners that have improved. The first one is improved coordination of tobacco control interventions at all levels. By establishing more platforms for discussion, experience sharing, and peer learning at national and regional levels, the coordination of tobacco control interventions was improved in Africa. The strength of partnership with the tobacco control community are impressive. Partners are joining efforts to build more capacity across the region. Learning and exchange tours are organized for experience sharing. As a result, we are seeing more structured interventions happening in the region and witnessing the emergence of a young generation of advocates equipped with the right skills to join the fight. The second is significant strengthening of tobacco control policy and legal frameworks in Africa. For a long time, Africa was referred to as the continent with inexistent or weak legal frameworks for tobacco control. But with sustained efforts by all partners, an increasing number of countries are passing comprehensive and strong tobacco control laws, the most recent being Benin, Cote d'Ivoire, Mauritania, and Ethiopia. Other countries are steadily making progress in implementation by adopting the necessary regulations to effectively enforce the law. For example, Burkina Faso, Gabon, Nigeria, Mauritania, Senegal, the Gambia. As evidence of this strong move, the Ministry of Health of the Republic of Senegal received the Bloomberg Award for its exemplary implementation of graphic health warning at the 17th World Conference on Tobacco or Health held in Cape Town, Republic of South Africa in 2018. The third point is protection of public health policy from the vested interest of the tobacco industry. Now, the Constitutional Court in Uganda and the Supreme Court in Kenya have taken bold steps in protecting the health of their respective populations by dismissing tobacco industry claims, challenging tobacco control legislation in both countries. This is a victory not only for tobacco control stakeholders in Uganda and Kenya, but also in the region. And these landmark decisions are consistent with Article 5.3 of the FCTC, which requires countries to make all efforts to protect their public health policies from vested interests in the tobacco industry. I am pleased that ACBF has made contributions to our collective successes by, number one, strengthening the organizational capacity of its partners in line with its mandate, enabling them to effectively perform their work, which has resulted in their ability to greatly contribute to tobacco control interventions, either at the country or regional levels. Evidence of this contribution includes the improved visibility of some of the partners and their ability to attract even more funding. Their increased recognition as reliable partners by government. The Alliance for Tobacco Control in Africa, ATCA, has become a strong network leading the work of the tobacco control civil society organizations in Africa. This Sefako Magato University now offers the first online course in Africa on tobacco industry monitoring. Next point is that supporting a systematic tobacco industry monitoring and response with advocates trained by SMU, coordination teams established at country level, and ATCA providing mentorship to the teams towards monitoring the tobacco industry influence. Lastly, it's increasing homegrown data in tobacco economics, tobacco industry monitoring, and other areas. Through projects implemented by the Research Unit on Economics of Excisable Products of the University of Cape Town, the Sefako Magato University's African Center for Tobacco Industry Monitoring and Policy Research, and the Centre pour la Recherche Économique et Sociale, civil society organizations and think tanks initiative which ACBF coordinates. So ACBF succeeded in expanding the scope of the think tank's research work to include tobacco control research agenda. To date, the knowledge in tobacco control issues in selected think tanks has increased. Research papers have been produced to inform policy change. So ACDF's three-pronged approach, which entails, first, assessment of capacity needs and gaps. Second, designing of customized capacity development plans. And third, provision of implementation support. Third, designing of comprehensive projects as opposed to the activity-based model, and implementation of multi-year projects has really proven to be a robust method for effective and sustained tobacco control program delivery. This approach significantly contributed to the results recorded in the target countries, which as the establishment of the functional national tobacco control program in Senegal and passage of tobacco control laws in Benin, Mauritania, and the Gambia. Honorable Minister, distinguished partners, ladies and gentlemen, despite these successes, there remains significant challenges to tobacco control in Africa. Kindly allow me to list just a few as we perceive them at ACDF. The first relates to the serious gaps that remain in availability of local evidence to inform tobacco control. The second is the lack of recent and reliable statistics on tobacco use and its impacts on Africa. You would recall in this regard that while I gave you 2021 global statistics, I had to go back to 2016 to give you any figure at all about Africa's situation. The third is the continued expansion of tobacco farming in Africa. In its 2021 status of tobacco production and trade in Africa, the WHO states that there were only 2 main tobacco leaf growing countries in Africa. But in 1995, and that number has grown to 5 today. This is important because of the high prevalence of use of tobacco by young people who work in these industries. The fourth is the sophisticated tactics of the tobacco industry, which take advantage of the lack of countering continental framework and industry's influence in the main tobacco producing countries in Africa represents a clear barrier to such continental framework. The continued effectiveness of our tobacco control response in Africa will require from all of us, the African Union, regional economic communities, governments, civil society organizations, tobacco control partners, to have a decisive partnership towards, number one, producing more locally generated data and homegrown statistics to respond to the first 2 challenges and further improve policy formulation and implementation. Second, providing credible alternative livelihoods to tobacco farmers to address the third challenge and protect future generations from smoking. And third, intensifying advocacy supported by evidence of the damages caused by smoking to public health and the economy, to enhance political will for effective continental, regional, and country tobacco control policy frameworks and legislations. All these actions require resources, and it is time that African governments get involved in the mobilization of domestic and partner resources to invest in tobacco control, hence giving our funding partners the incentive to continue. Honorable Minister, distinguished partners, ladies and gentlemen, the need to sustain capacity development of tobacco control actors across the continent cannot be overemphasized. Enhancing capacity is a requirement in the entire responsibility chain, from development of research to action. These include addressing gaps in such areas as capacity to understand the issues, including conducting sound research to generate local evidence, capacity to coordinate initiatives, programs, and strategies to avoid wasteful duplication of efforts and promote work towards a common goal at national, regional, and continental levels, capacity to not only adopt, but also effectively implement policies and legislation, capacity to deliver results, evaluate and monitor our impact on an effective reduction of tobacco use prevalence, capacity to document key success stories and share lessons learned with tobacco control actors across the continent, capacity to advocate for local resource mobilization, establish domestic funding mechanisms for sustaining tobacco control and creating effective partnerships, and capacity to rapidly adapt to a changing environment and be innovative in order to tackle issues such as emerging tobacco products. So addressing these capacity gaps, which is a collective endeavor, will go a long way in enhancing the effectiveness of tobacco control further. and the tobacco epidemic represents a barrier to achieving the United Nations Sustainable Development Goals and the African Union Agenda 2063. Honorable Minister, distinguished partners, ladies and gentlemen, let me observe that the conference has come at the most opportune period when COVID-19 has brought the weaknesses of the health infrastructure in Africa to the fore. As African countries struggle to acquire much needed vaccines, other countries in the developed world have piled up and are talking about having 10 doses as boosters. In the face of such wide disparities in access to health, to medication, and African countries cannot afford to compound the situation with avoidable tobacco-related illnesses and deaths. The current health crisis, which has profound social and economic implications, has also revealed the pressing need for us, tobacco control actors, to reflect on how we can continue doing the work that we do more effectively under unusual circumstances, such as the restrictions to movements and social distancing. Under these circumstances, all of us gathered here today and the next 2-3 days have the unique opportunity to contribute to curb the tobacco epidemic by working together to implement the FCTC, whose objective is to protect present and future generations from the devastating health, social, environmental, and economic consequences of tobacco consumption and exposure to tobacco smoking. Honorable Minister, distinguished partners, ladies and gentlemen, normally I don't speak for too long, but I'm sorry I took some of the more time that I should probably take. But in conclusion, I wish to again reaffirm the importance that ACBF places on capacity development. And this is what the foundation is bringing to the tobacco control agenda in Africa. ACBF, which by the way, last week celebrated its 30th anniversary, is therefore happy to bring more than 30 years of experience and track record in strengthening capacities in Africa, building partnership with and supporting the African Union Commission, the regional economic communities, and the public sector institutions, including government, ministries, central banks, and parliaments. With its vast experience, leadership, and commitment to the core mission of building human and institutional capacity in Africa, ACBF has its doors open to all willing and able to support capacity building in tobacco control in Africa. I deeply appreciate your participation, cooperation, and contribution for the success of this very important conference in advance, and feel certain that the results will lead us to the next step in our endeavors to build a sustainable tobacco control in Africa and together face the development challenges of the continent. Thank you very much for listening, and I wish you a fruitful meeting. Thank you for your kind attention, and wish success to the first Africa Tobacco Control Conference.
Prof. Ndozi, thank you so much. And please don't apologize, because these are important things that we need to spread the word on. And absolutely, I mean, based on just those terrifying, and I think you used the absolutely correct word, terrifying numbers that you told us about, especially related to younger children, those who are under 18. I mean, the numbers for 13 to 15, and I'm sure there are kids younger than 13 who are smoking. We just haven't been able to collate the numbers there, but it is mind-boggling that on a continent where food and health should be a priority, that this is what our youngsters are spending their money on, or worse still, if somebody is giving it to them for free, to actually get them into these very, very disgusting habits as well. So thank you. And I think you were absolutely right that this conference comes at the right time, especially as we continue to battle COVID-19. I think that now is the time to actually seize the moment. So thank you very much. And we all look forward to hearing just what the solutions are that come out of the discussions over the next couple of days. I must apologize in advance to everyone who is attending today. We were due to hear from Dr. Jane Acheng, the Ugandan Minister of Health. She was due to send us a welcome message, but we do seem to be having a problem getting that message through. But I think we kind of get the gist from everybody who has spoken so far, just what the significance of this conference is, what your participation in this conference actually means, just how historic it actually is. And Anne-Marie and myself, we are indeed indeed honored to actually be a part of the first one, as I said earlier, and I'm hoping that we will be included in the years to come, even though it's 4 years from now. Who knows where we'll be, Anne-Marie? But I think, you know what, let's just hope that they do remember us and invite us back to see what the progress has been, because I certainly will be watching the space very closely. So I think we'll head on over now just to the plenaries, and let's get to the meat of all of this, Anne-Marie, and let's let the decision makers and the solution finders actually get to work. What do you think?
Absolutely. Thank you so much, Uveka. Indeed, you know, we really hope to be part of that conversation pour les années à venir. Nous sommes ici pour ça. Et comme tout le monde l'a souligné, il y a d'énormes défis, mais il y a aussi tellement de potentiel en Afrique pour atteindre tous nos objectifs. Nous sommes tous réunis ici ensemble, justement pour faire avancer l'Afrique. Et puis surtout pour construire un meilleur avenir pour ces jeunes. Le professeur Nawangé l'a mentionné, le professeur Nindosier, les jeunes filles sont de plus en plus atteintes, les jeunes enfants également. Donc maintenant, il est temps de passer à l'action. Et puis tout de suite, il est temps, comme l'a dit Uveka, de passer à notre session plénière.
And as many of our delegates have already alluded to, Anne-Marie, I mean, for the main plenary today, we are setting the scene in terms of the tobacco control landscape here in Africa. Now, this conference has really been established, as we heard from the Prof, at the right time to harmonize and promote cross-learning and sharing of scientific research results and program implementation lessons in terms of tobacco control in Africa. But we can't do any of that if we actually don't know what has been happening on the continent. Where have we been? What is happening at the moment? And we heard some worrying figures just a couple of minutes ago there from Professor Nadozi as well. So that's an indication. I mean, things are very, very dire. It's a dangerous situation out there. Where are we currently? What is the status quo? And where are we actually going with all of this? How do we fix it? How do we stop it in its tracks right now? And that is certainly going to also, that is a long, long journey ahead, I'm guessing. So that's exactly what today's panel is actually planning to discuss there. And let's remind you of the theme as well. The theme of this conference, the first ever, a tobacco-free Africa, an urgent call for joint action. It is indeed urgent.
Merci beaucoup, Veka. C'est une urgence d'envergure, évidemment. Et alors, pour cette session plénière, eh bien, nous avons bien sûr le soutien et toute l'expertise de nos experts. Alors, pour récapituler, il y a la docteure Adriana Blanco Marquizzo, qui est, je le répète, chef du secrétariat de la Convention cadre de l'OMS.
And Dr. Blanco Marquizzo is joined by Dr. William Maina, who is a public health specialist for the WHO Afro region and has spent many years actually in tobacco control. So all the right people in the right places.
Mm-hmm. Absolument, absolument. Et nous avons bien sûr le docteur Ahmed Ogwel Ouma. Alors, bien sûr, eh bien, cette session plénière, comme vient de le dire ma co-modératrice aujourd'hui, elle va eh bien, dresser le bilan de la situation où nous en sommes. Donc, I'm going to start in English with you, Dr. Blanco Marquizzo. Could you please provide us with a broad overview of the FCTC and tell us about the progress to date, please?
Thank you. Thank you very much, moderator. Dr. Masidisho Moeti, Regional Director for the WHO Regional Office for Africa. Mrs. Sis Mariama Mohamed, Directorate of Social Development, African Union. Dr. Ahmed Ogwel Yuma, Deputy Director of Center for Disease Control Africa. Mrs. Cindy Lewis, representative from the Gates Foundation, colleagues and friends. I'm delighted to join you virtually at this important inaugural, as you said, first ever Africa Conference on Tobacco and Development. It would have been wonderful to have met in person, but unfortunately that is not yet possible due to the ongoing global pandemic. The WHO Framework Convention on Tobacco Control is an accelerator for sustainable development. That is why strengthened tobacco control through implementation of the convention is included as one of the means of implementation for achieving targets for Sustainable Development Goal 3. This specific link is clear recognition of the enormous avoidable burden that tobacco use inflicts on health and health system, threatening also sustainable development everywhere. Contributing to this burden is the fact that tobacco use is still rising in some low and middle income countries, contributing to a growing epidemic of non-communicable diseases and health inequities. And we must remember that tobacco is also a risk factor for communicable diseases, such as COVID-19 and tuberculosis. Fortunately, since the treaty entry into force in 2005, countries in the WHO African region have demonstrated an undivided commitment to protecting public health and saving life by supporting the implementation of the WHO FCTC. To date, 44 of the 47 countries in the African region have become party to the WHO FCTC, and 20 of them have also joined the protocol to eliminate illicit trade in tobacco products, which entered into force in September 2018. In fact, we welcomed Ghana's ratification of the protocol only a few days ago, when it joined other African countries in taking regulatory measures to prevent the trade of illicit tobacco products across their borders. And African parties to the convention and the protocol are not just paying lip service to its obligation. There is a clear commitment to the implementation of both treaties. Several countries have adopted comprehensive tobacco control laws, and prominent pictorial health warnings on tobacco products are increasing across Africa. We are hoping to soon welcome the first country in the region to introduce plain packaging to further complement existing strong tobacco control measures. Nonetheless, we need to continue to encourage countries to reduce the affordability of tobacco products through the adoption of a strong tobacco taxation policy. Strong tobacco taxation policies deliver enormous benefit for public health, as well as raise significant revenues for government. This factor may be especially important as government try to identify funds to help with recovery from the pandemic. To support parties in their action in this area, our WHO FCTC Knowledge Hub on tobacco taxation, based in South Africa, has well-recognized experts available to assist governments in their efforts. The WHO FCTC also encompasses other areas of particular importance and challenges from Africa, like Article 17, that require parties to promote economically viable alternatives for tobacco workers and growers, who often suffer very poor conditions and frequently involve child labor. In addition, I would like to underscore the current relevance of Article 18 that supports the protection of the environment. In addition, electronic nicotine delivery system and novel and emerging tobacco products are also creating new challenges for parties. But let me remind you that decisions of the Conference of the Parties to the Convention are available to guide parties on how to best to regulate these problems. Of course, tobacco industry interference continues to pose an enormous challenge to ending the tobacco epidemic in all countries. We have seen the tobacco industry continue to focus their attention on Africa to build markets for their uniquely harmful products. We must remain vigilant and continue to protect our policies from the irreconcilable interests of the tobacco industry. Their efforts to undercut successful tobacco control have continued unabated during the pandemic and have accelerated in the lead up to the virtual session of the 9th session of the Conference of the Parties to the WHO FCTC and the second session of the meeting of the parties to the protocol in November 2021. In this context, implementation of Article 5.3 of the Convention remains more vital than ever. The Convention Secretariat continues to stand with parties to the Convention and the protocol to provide support to them. Since 2017, through the FCTC 2030 project, the Convention Secretariat has provided targeted support to lower and middle income parties to strengthen their implementation of the WHO FCTC. In the African region, Cabo Verde, Chad, Burkina Faso, Eswatini, Ghana, Madagascar, Mozambique, Sierra Leone, Tanzania, and Zambia have been included in that effort. In all 10 parties, we are supporting policies aimed at reducing the affordability of tobacco products through increased tobacco taxes, as well as policy to fully protect citizens from exposure to tobacco smoke and to minimize the attractiveness of tobacco products and ensure that packages do not promote misleading messages. In addition, we are working with government to strengthen their tobacco control governance. For the successful delivery of the FCT 2030 project, we are thankful to WHO, including their regional and country offices in Africa, and to the United Nations Development Programme as our project delivery partners. And of course, we are constantly exploring additional avenues to continue our support for parties for the WHO African region. Since 2020, we have been working with regional stakeholders, and we have initiated efforts to collaborate with the economic community of West African states, the ECOWAS Bank for Investment and Development, the West African Health Organization, and the Southern African Customs Union. While we have seen much progress in tobacco control at the country level, greater success can be always achieved through international cooperation and a multi-sectorial approach. As countries cautiously look ahead to the recovery phase of the COVID-19 pandemic, I will also urge all parties to continue to prioritize the implementation of the WHO FCTC and the protocol in their Build Back Better strategies. Let me close by recognizing the enormous level of commitment to the WHO FCTC and the protocol that is evident in Africa, and for the achievements that many countries have made in tobacco control in often challenging circumstances. I also wish to congratulate the Center for Tobacco Control in Africa for its valuable efforts, including the hosting of this important event, the first African Conference on Tobacco and Development. For those of you attending COP9 and MOP2 in November, I look forward to your participation as we push forward together in our agenda towards a healthy, sustainable, tobacco-free future. Thank you very much.
Merci énormément.
Thank you so much for that. And I think, yes, we are all looking forward to that. And just listening to what you say, it is indeed time to tighten the screws, because that is how you're going to get results. We've got to tighten that and sort of hurt them where it hurts, hit them where it hurts the most, if I were to be crude like that. So thank you so much for that. Well, now to help us zone in on the local continental picture, we move to the World Health Organization Afro regions, Dr. Maina, who's going to give us an idea of the current status afforded to tobacco control in the Afro region, looking at some of the native successes, challenges, and lessons learned. Just a bit about Dr. William Maina. He comes with 22 years of experience in health services management in developing countries, having served in different portfolios in the Ministry of Health in Kenya and as a senior project officer in the World Health Organization. So he absolutely knows what he is talking about. Dr. Maina, good morning, and thank you for joining us.
Good morning, and thank you, the moderator, for that beautiful introduction. The organizers of the first African Conference on Tobacco and Development, my fellow panelists in these discussions, participants, ladies and gentlemen, I'm very grateful to be here today and speak in terms of what's happening in the African region. And I'm happy to speak that on behalf of the WHO Regional Office team. First, I would like to convey a message of goodwill from the Regional Director for the African region, Dr. Moeti, and the rest of my colleagues at the WHO Regional Office for Africa. I take this opportunity to thank the organizers of this conference for involving WHO Regional Office from the planning up to the execution of this conference. We feel very much honored. Secondly, I want to really congratulate the organizers of this conference for bringing up this conversation to the African region, and especially having planned this conference in a very difficult situation due to the challenges posed by COVID, where you had to hold most of your planning meetings online and at times with poor internet. But at the end of the day, you have successfully come to the implementation of this conference. As many speakers have spoken before me, I think my work has been made easier because most of the things I wanted to highlight have been mentioned. And from what we have heard from various speakers is that the African region has made tremendous progress in tobacco control. And you have really seen that actually Africa is on track in terms of achieving global targets. Africa started from the days when the FCTC was being negotiated, and we saw a lot of leadership from African countries, specifically from various champions, where Africa contributed massively to the discussions and coming up with a document that we use today as the Framework Convention on Tobacco Control, and even later on during the negotiation of the protocol. And therefore, this region has actually demonstrated high support for this, for the treaty and the convention. And as we have heard from many of the presenters, is that we have high level of acceptability of this treaty within the region, where out of the 44 countries in the African region, 44 have ratified or acceded to the treaty. And currently we have 21 countries in the region that have actually ratified the protocol to eliminate illicit trade in tobacco control. And therefore Africa contributes over 30% of all ratifications of the protocol. But acceptance of the FCTC and the protocol is not enough to protect the people in the region from the health, social, and economic effects of tobacco use and exposure to tobacco smoke. The implementation of comprehensive tobacco control programs, interventions, particularly at the country level, is what will save our population from the disabling diseases that are caused by tobacco use and exposure to tobacco use. And therefore, we need to work hard, all of us, to ensure that each and every country in our region implements comprehensive national tobacco control laws and regulations. And this is the only way that we are going actually to protect our region. Let me highlight some of the progresses that we have recorded in the recent past. To date, out of the 47 countries in the region, 36 countries have actually passed laws that actually regulate or control tobacco in one way or another. Out of these, 29 countries have laws that are aligned to the Framework Convention on Tobacco Control, whereas we have 7 other countries that actually passed laws way before the treaty came into being and are in the process of trying to update their laws so that to make them aligned or compliant with the FCTC. And therefore, as a region, we need to work more because we still have 11 countries that actually their populations are not protected as they don't have any existing tobacco control laws. In terms of the issue of the specific provisions in the Framework Convention on Tobacco Control, as you have heard from my predecessor and the opening ceremony, is that we have seen that out of the 47 countries, 36 have actually put some restrictions of smoking in public places. And we are happy to report that 11 of the countries in the region have actually 100% smoke-free laws, whereas 5 others are putting restrictions, but we are still working on those that are provided for the designated smoking areas to review their laws and ensure that Africa becomes smoke-free continent and region. 33 countries prohibit advertisements through their laws, and we have 14 countries that have total bans on all forms of tobacco advertisement, promotion, and sponsorship, whereas we have a few that have actually partial bans, and we are working to support these countries to continue reviewing their policies and laws to ensure that we make sure that they all implement total ban on tobacco advertisement, promotion, and sponsorship. 24 countries have enacted laws that provide for the implementation of large graphic health warnings, 24 out of 47, that is 50%. However, up to date, 14 countries have actually implemented large graphic health warnings. And we are happy that we have countries that are actually reviewing their legislation and regulations to ensure that they implement not only large graphic health warnings, but they even go to the implementation of plain packaging. And very soon, Africa will have a country or two or many that will be implementing plain packaging. In terms of the implementation of progressive taxes, and like you have heard from the last presenter, the issue of affordability of tobacco products is a big problem in the African region. And this basically is because this is one of the regions where the price of cigarettes is quite low relative to other consumer products. And this is because of the low level of taxation and the nature of the tax policies that we have in the region. So we find that although 22 countries have made very big progress in terms of reforms in their tax policy for tobacco, including raising the tax rates and also reviewing the tax structures, we still have only 4 countries that have reached the recommended 70% of total share of the retail tax price to be excise tax in the region, where 10 countries are actually between 50 and 70%. And therefore, we have many countries that are still having very low tax rates for tobacco and therefore very low prices for tobacco products, which makes these products very affordable, especially to young people and the youth, and promoting tobacco consumption. So we still need to do a lot of work in terms of trying to support the countries in the region to actually reform their tax policies with the aim of increasing the tax rates, reforming their tax structures, and implementing tax administrative measures that ensure that the prices of tobacco continue to increase and therefore make these products less affordable and reduce consumption. We have various challenges in the African region, and we all know that the biggest challenge in our region is tobacco industry interference. We have seen them apply their tax tactics in terms of interfering with the policy development, delaying the implementation of policies, and even going to the extent of taking government court in litigations so as to slow the progress of the implementation of the tobacco control. We must continue calling them out. We must continue looking out for major mechanisms that the industry is using to interfere with our policies, bring them out and expose them, and then we counter their tactics. There is also the problem of inadequate resources, particularly financing for tobacco control programs in the African region. And this is basically tobacco has low prioritization within the various sectors in terms of financial resources and also in terms of the human capacity that is actually placed for tobacco control. And we need to work more to ensure that there is sustainable financing for tobacco control programs in the African region, especially looking at how we can target tobacco tax revenues to be channeled towards financing or taking care of tobacco control programs in the region, and even covering more support for health programs within our countries. There is lack of capacity for tobacco control. You may find some countries that only one person is placed as a focal person for tobacco control, and he is the only program person in government who is responsible for tobacco control. And this person is not able to actually function in terms of meeting up all the needs of various actors for tobacco control. And therefore, there's need to build the capacity for tobacco control so that we can have enough capacity in terms of human resource and infrastructure for tobacco control in the African region. And finally, we have a challenge of emerging and novel nicotine and tobacco products. These are new products that are coming into the market in the African region in a big way. And they are coming at a time when our laws do not address their regulation or their control. And therefore the industry is using that vacuum or that lacuna in law where where most of the laws were actually developed when these products were not in the region. And therefore they are becoming a challenge in terms of how we regulate them. We are happy to report some of the countries that have recent laws, some of them like Ethiopia, Uganda, and Gambia have actually totally banned the importation, manufacture, and even sale of electronic cigarettes in their country. And we are encouraging more countries to ensure that we have actually stringent laws regulating these emerging nicotine and tobacco products. And there are lessons that we have learned as a region is that tobacco countries with good political will and a strong capacity have actually strong and comprehensive tobacco control programs. And the issue of consistent high quality technical assistance alongside country level capacity building has been a fundamental driver for effective tobacco control in terms of policy development and implementation. And therefore, all partners need to work to support governments to build a high level of capacity for tobacco control implementation within the region. And of course, there is need for sustained advocacy because this is a kind of a driver and an engine for sustained tobacco control. And we are very happy that most of the advocates in the region have been very vocal and have been driving the tobacco industry out through speaking out and looking out on them and supporting government to actually address the challenges, particularly those posed by tobacco industry interference. The role of civil society cannot be underscored because there are major and a prerequisite for sustained advocacy, including keeping the government on check and stopping tobacco interference. And therefore, we need to laud the work of the civil society. We need to also recognize the issue of the regional economic blocs and the regional consensus that has helped to create a momentum for tobacco policy change in the region, particularly when providing platforms for countries to have a peer learning platform or environment where countries can compare how they are performing, how they are doing things in tobacco control, and therefore create a kind of momentum where each and everyone has been challenged to move forward in terms of implementing their tobacco control in their country. So this is just a snapshot of happening in the African region. And I want to acknowledge the roles that have been played by various actors, including governments, intergovernmental organizations, civil society organizations. Specifically, we have the core partners in the African region that have been supporting governments and the civil society in the region to try and drive the momentum of tobacco control in the African region. We can't forget the communities and individuals, particularly those champions in the African region that actually have driven tobacco control agenda in the African region for a long time, and they are continuing to do so up to now. So finally, is to thank the organizers of this conference for inviting me to make this presentation, and I wish you all a fruitful discussion. Thank you.
Well, Dr. Maina, thank you so much for that. And yes, and I think everybody cannot stress enough just what it is this conference can achieve, especially with the expertise we have sitting on our screens and on our panels here as well. So thank you very much for that. And I think absolutely what we said earlier, it is a long journey, but it is going to be worth it, even if we don't, some of us are not here to see the changes for our children and our grandchildren. The changes are going to mean a very different planet that they are going to be living on, especially when it comes to their health. Anne-Marie, I'm sure you agree with me.
Absolument. Merci énormément au docteur Maïga. C'est vrai, on doit travailler dur et ensemble. C'est le seul moyen de protéger notre région. Retenons bien donc ces recommandations et également ce que tu viens de mentionner, Uveka. Et j'aimerais partager ce petit proverbe africain avec vous. Le soleil n'oublie jamais un village, même s'il est petit. Alors, messieurs, dames, pour atteindre notre objectif, comme l'a si bien dit le docteur Maïga, nous avons besoin d'unir nos forces. Et bien sûr, c'est un ensemble global de mesures dont nous avons besoin, tant au niveau de la taxation, comme on vient de l'entendre, que des stratégies socio-économiques et politiques, bien sûr. Alors, mesdames et messieurs, difficile évidemment de faire l'impasse sur la pandémie sans précédent que nous traversons actuellement. Et le dernier point que nous allons aborder aujourd'hui, c'est celui de la Covid-19 qui chamboule totalement notre quotidien depuis à peu près 20 mois. Et son impact, bien sûr, on aimerait savoir quel impact cette pandémie a sur la lutte contre le tabagisme en Afrique. Et pour nous en dire plus, accueillons de nouveau le docteur Ahmed Ogwel Ouma.
Good morning, good afternoon, good evening, wherever you are joining us from. My name is Dr. Ahmed Ogwel Ouma. I'm Deputy Director at Africa CDC, and it is my pleasure to join all of you today at this first Africa Tobacco Control Conference. I would like today to share some of our work, our observations and lessons in the context of COVID-19, and which we believe can be very useful for tobacco control work here on the continent. Indeed, it is very good to see so many colleagues from tobacco control in my days in tobacco control and NCDs And I'm really glad that this particular conference has at last taken place, and let us make it as regular annually as is possible so that tobacco control remains a very key agenda item for Africa's public health and development agenda. I'll divide my presentation into these three parts. Talk a little bit about the updates on COVID-19. We share some lessons learned, and then we also share some takeaway messages. So to begin with, COVID-19 on the continent, this map tells us that the pandemic has reached every country on the continent. Some are affected much more than others, but the message is that the whole continent has currently been affected. Second message on this is that as countries are affected differently, there is opportunity to be able to intervene and put a slowdown or even a stop to the numbers of COVID-19 cases. It's very similar to tobacco control, and it would be very good to see a map like this of the continent on how the tobacco pandemic is actually affecting us on the continent. In terms of actual numbers, in Africa CDC, we divide our continent into 5 regions. And you will see that although the whole continent is affected, some regions, particularly the southern and the northern, are affected a lot more than the other regions. Not just because the populations are different, but also because the way in which the pandemic has been evolving on the continent is also different. This particular graph is very important because it shows that the pandemic has been coming in waves, and each subsequent wave is actually more severe than the one before it. Pretty much like tobacco effects on the continent as well, when we document it well, we see that each and every generation is affected in a more severe way than the previous generation where tobacco control and its effects are concerned. So there are very, very good lessons to be learned, one from tobacco control to COVID, and in the context of today, from COVID to tobacco control. So some observations that we have made during our response to this pandemic in the last 18 months or so on this continent include the following. One is that members of the public are key to the success of any population level intervention. Tobacco control in general, the majority of its tools are population level interventions, and therefore it is a lesson for us to learn in tobacco control from COVID. One is we need, in the context of the public being key, we need to share the correct information and in a timely manner. Let us not wait until the tobacco industry has put out misinformation and then we correct it after that. We need to be providing that information upfront ourselves so that members of the public get us as the primary source of information. Second is that this particular engagement with the public needs to be regular, and it needs to be very open. When something is not working, we need to be open with the public. When something is working, we need to be open with the public, and we need to do it regularly. Not only wait for World No Tobacco Day on the 31st of May, and then the rest of the year, there's not much that is going on with the public. The engagement has to be regular, and it has to be very open. Thirdly is we must demystify the topic. We have demystified COVID-19, providing every aspect of this pandemic to the public. In the same way, tobacco control needs to demystify the whole area of tobacco, its growth, its manufacture, its use, and its effect. And we must tackle misinformation quickly and very, very robustly. The second observation we have made is that the public health space needs allies. We should not be talking to ourselves. It becomes an echo chamber, and in that way, there is no new message that comes our way. So like in the context of tobacco control, we need domestic ownership. We need ownership within Africa. You as tobacco control advocates must be able to approach and secure prominent Africans to be your champions for tobacco control work on the continent. We have done that in COVID-19, and the dividends are huge. We are reaping quickly, and we are reaping the champions' dividends effectively. Under the public health space allies, the second observation we have made is that the youth are a strength. Indeed, because they're the majority on the continent, and because they are so savvy when technology is concerned, you want them on your side. Make the youth movement work for tobacco control. The final observation that we have made is that the Africa Continental Free Trade Area, the AFCFTA, is a huge opportunity for public health. This treaty is now in force and is going to encourage and facilitate intra-Africa trade. When this is going to be happening, let not tobacco products be the first on the line. Make sure that you are intervening with the AFCFTA Secretariat, which is based in Accra in Ghana, and you are selling the message that tobacco products are a health hazard and therefore should not be given preferential treatment. These observations are very important in the context of tobacco control. So which lessons have we learned and which are important for tobacco control in Africa? Number one is that coordination and collaboration and cooperation are extremely critical, and these need to be at the highest level. This is the only way we can be able to get a whole of Africa approach. For our COVID-19 response, we have been regularly briefing our heads of states. We've met with them in excess of 18 times since the pandemic started. We have been engaging and briefing our ministers and all relevant sectors we have talked to: health, finance, transport, and trade. You as tobacco control advocates need to ensure that the coordination, collaboration, and cooperation in the context of tobacco control captures these senior policymakers. We also have been talking to our senior technical officials so that at director and above level, they also have clarity of the message of COVID-19 in our context. And for you, they need to have the message of tobacco control. The second lesson that we've learned that is relevant is that for us to be able to achieve success, we must have continent-specific instruments. In the context of tobacco control, although we have the WHO FCTC, which is a global treaty, at the moment, you do not have anything at the Africa level, and you need to engage with the Africa Union. And I'm glad that my colleagues from the Health, Humanitarian and Social Development Affairs Department are here. You need to engage with the Africa Union so that you have continental instruments to guide implementation on the continent. At the same time, Africa is divided into regional economic blocs, the so-called RECs. And these RECs have responsibilities as well for the region. You need tools and agreements, indeed decisions at the regional level through the RECs so that implementation becomes easier. One final lesson that I would like to share is that we must have continental institutions that are going to drive the agenda of tobacco control. In the case of health security, we have the Africa CDC, we have the Africa Medicines Agency that is just, the treaty has come into force, is about to come into force. And we also have the Africa Union Development Agency, AUDA NEPAD. These three are very key for health security agenda for Africa. In similar fashion, tobacco control needs an intergovernmental institution to champion the cause on the continent. Without this, then the agenda is not discussed regularly and does not attract the correct attention at the correct levels on the continent. Fourth is we need qualified workforce. To be able to tackle tobacco control effectively at the continental and country levels, we must have a multidisciplinary approach. And as I said, don't talk to yourselves. You need to speak to other professionals. You need to speak to other cadres. You need to speak at different levels, whether it is sub-country, country, regional, or continental levels. Finally, is we need a very broad partnership to be able to tackle tobacco control effectively. We must, in these partnerships, go beyond the tobacco control community. We must go into carefully into policy making. We must go carefully into the community. We must go carefully into the private sector. And these need to be coordinated by that institution I talked about at the continental level that will be championing tobacco control. So these are some of the lessons that we have learned during this pandemic, and which will be very, very useful for the tobacco control movement here on the continent. As a takeaway, I would like to leave you with what we call Africa CDC's new public health order. Multilateralism at the global level has failed when health security, where health security is concerned, particularly in the context of COVID-19. We see multilateralism as an opportunity for tobacco control, but you need to be careful that it does not drag response to be something that is an afterthought rather than the first part of the agenda for the continent's public health infrastructure. So our new public health order as Africa CDC has 4 pillars. The first is strengthening of public health institutions at the continental, regional, and national levels. The tobacco control community can be able to borrow this and use it as well to achieve success in Africa. Secondly, is we need a strengthened public health workforce. We must build our numbers across all expertise, all cadres, and all levels. And these experts that will have been trained in tobacco control can then be able to drive the tobacco control agenda on the continent. This second pillar of Africa CDC's new public health order can be borrowed by the public health, by the tobacco control community, again, for success. Third is expanded manufacturing of everything we need in health security. This is extremely important for the tobacco control agenda because it provides alternatives to tobacco farming and tobacco manufacturing. So again, it can be able to be borrowed by the tobacco control movement. Finally, is respectful and action-oriented partnership. This is the last pillar of the Africa CDC's new public health order. And these partnerships must carry Africa's priorities. And our priority on this continent is going to be driven by our institutions, by our experts, based on our priorities. And this is important so that we are not driving somebody else's agenda and we are not providing visibility to someone else's priorities. So these 4 pillars of Africa CDC's new public health order can be borrowed by the tobacco control community to good effect and to success on the continent. I thank you very much for the opportunity to engage with you today. I'm looking forward to the outcomes of this conference. And as Africa CDC, we remain available to engage with the tobacco control community in Africa as we try our very best to ensure that the tobacco control agenda is a priority on the continent in the context of Agenda 2063 and in the context of ensuring that the Africa CDC's new public health order is implemented to the benefit of Africa. I thank you.
Dr. Omar, thank you so much for that. And I think it is very reassuring as well for the rest of us to actually see a plan, to see the tools that are at hand to actually make this possible. And a very good day, good morning, good afternoon, wherever you might be in the world, to the delegates who have just joined us, or if you joined us a little later, the first Africa Conference on Tobacco Control and Development, welcome to it. And just a quick note from our organizers, for anybody who might be having some problems, delegates who are having trouble Control accessing the conference, please follow these steps if you can. Please go onto the Hoover app. I think it's Hoover app, WHOVA, that's how it's pronounced, is Hoover, and log into your account, and then click on Agenda on the sidebar if you see it there, and then click on View Session. So that's the Hoover app. Log into your account there. When you get to the app, click on Agenda, which appears on the sidebar, and then click on View Session. That is what will appear there. Alternatively, you can go to www.actd.africa. That's www.actd.africa website. Access the session through our agenda button there, and it'll be actd.africa/FR/agenda/. Let me go through that again. That's actd.africa/FR/agenda/ and then click on Join Stream. And hopefully you'll have some luck just getting into the conference and accessing it in a better way from there.
Merci beaucoup, Veka, pour toutes ces recommandations. Alors, c'est vrai que c'est un événement absolument historique. Merci pour tous les messages que vous nous envoyez, des messages, vous semblez apprécier cette conférence virtuelle hors du commun. Et nous présentons bien sûr nos excuses pour les désagréments au niveau de la traduction. Ce sont les aléas de ces conférences virtuelles. Et bien sûr, nous nous efforçons de résoudre le problème, bien sûr, pour votre confort. Alors, il est temps de passer rapidement à notre session plénière du jour et l'occasion pour moi de rappeler nos illustres panélistes qu'ils sont la docteure Blanco Marquizzo, le docteur Maina et le docteur Oguel Ouma.
Right, so I'm going to put my hand up first. Can I ask the first question, please,
Oui, bien sûr.
And that is for the question for you, Dr. Blanco Marquizzo. If you can answer this one for us, please. What is it actually that is holding countries in Africa back from fully implementing the Framework Convention on Tobacco Control? What is the problem?
If I need to say, I cannot say there is one problem because it's always multi-causal, but I think that as in many other areas of the world, the interference of the tobacco industry and the perceived eventual benefits of some countries that still are producers of tobacco are the main thing. But definitely the interference of the industry is everywhere, and it's very important to avoid countries to really implement the FCTC.
Thank you very much, Dr. Blanco Marquizzo. And may I say, muchas gracias.
Gracias a usted.
Muchas gracias, señora. So now I turn to you, Dr. Maina, and I would like to ask you, what lessons does the COVID-19 pandemic offer to tobacco control, please?
Thank you so much, Anne-Marie, and the other moderators. I think we have learned a big lesson from the COVID-19 that can be applied to tobacco control. And the most important is that we must be prepared to adopt to changes when they come. And this one caused us to review our strategies that we've been applying in tobacco control in the region, to see how we can try and reform the way we do things as situations change. One of the things that we have seen is that there can be unity of purpose across countries and across the globe. And this unity of purpose is what we need to seek in the African region, where there's one voice in terms of speaking for tobacco control. And this voice will go in two ways. One is kind of trying to harmonize our policies in the region. And secondary is trying to actually underpin the need for best practices in doing our tobacco control work in the region. This is what will bring the balance in terms of countries moving together and pulling together and working towards a tobacco-free Africa. This is my take on this. Thank you.
Thanks so much, Dr. Maina. Dr. Ogwal Omar, if you can join us once again. And, let's just talk about what is happening in Africa and the perception out there. And it's not my feeling, but the common perception out there, Dr. Omar, is that, when it comes to Africa, corruption abounds, that, you can buy your way into anything. You can buy sort of favors from governments. You can get yourself in there. I mean, obviously, we know this happens the world over, but it is a particular, I think, perception when it comes to Africa. So what would you say are the biggest stumbling blocks for tobacco control in Africa, and how big a part does all of that actually play? I mean, how far off the mark are they with those perceptions?
Thanks, Yuveka, and you'll allow me to speak without my camera on because of network issues.
No problem.
Let's start from the perception. The perception is based on very modest knowledge of the continent, and many who have the megaphones of talking about the continent, they don't know Africa. The Africa they know is the one they see on cartoons and the media. Those of us who know Africa, we know that we have challenges, but one of them is not necessarily related to corruption. That is a problem, but it's not one of the ones that we really need to deal with. And the way that I would say I would approach this, particularly now with a lot of hindsight, I was in tobacco control for a long time, I still am, although now I'm doing more health security, is that we tend to focus so much on the problem and not the solution. And this will be my sincere advice to the tobacco control community. We need to step back and not chase after the tobacco industry. They need to be chasing after us. We need to be chasing after the policymakers and the public, the two most important constituencies for any public health agenda to be able to be successful. But we are chasing after the tobacco industry so much. Our conversation is 60–70% tobacco industry. If we ask what the problem is, if we ask what the barrier is, we tend to move towards tobacco industry, and therefore they become the conversation, not the solution. We need to move away from that and start talking about the solutions, putting the solutions on the table for policymakers and also for members of the public, ignoring, I'm not saying ignore the tobacco industry, but certainly don't make it your topic all the time. Let the topic be the solution, and let the constituencies be the policymakers and members of the public. In this way, we set the agenda. Our conversation is the one that is being discussed, and therefore it's the one that is being paid attention to by both the policymakers and the tobacco industry. And I'm not saying it is easy, but I'm saying it is the path that is going to give us a new edge, particularly now when health and public health has become clearly a very, very important topic globally, and particularly so here in Africa. Change the narrative. Don't talk about the tobacco industry, talk about the possible solutions and engage with policymakers and the public. Thank you.
Wow, thank you so much. Let the topic be the solution, change the narrative, talk about thought-provoking punchlines. Thank you very much, Dr. Ogwal Uma. So we're just going to throw a little challenge at you just to wrap up this amazing historic conference today. Could you summarize the 3 key words that you would like us to take away from today's discussion? So this is quite a challenge, but in 3 words, how would you summarize the key issues and points that we need to remember? And we are going back to you, Dr. Blanco Marquizo, please.
3 words, oh, that is difficult. I should say tobacco hinders development.
Okay. All right, it's quite precise there. Dr. Maina, from your side, 3 words, and can I throw in an extra challenge there then? Of course, I suppose what the discussion should center around going ahead as we head into those workshops as well.
I think I'll put forward, difficult to do 3. For me is invest more in tobacco control in the African region. More investment for tobacco control.
More investment. Okay, great.
Thank you very much. And Dr. Ogwell Uma, your 3 words, if you can do it. I know it's not easy at all.
Well, where I come from, 3 and 4 are next to each other. So for me, it will be new public health order.
Okay, we'll give you the extra one. We'll give you the extra one. Fantastic. All right, thank you so much. Thank you so much to our speakers. And I think it's very encouraging, Anne-Marie. I'm very encouraged. I mean, this is the first one, and who knows how many conferences from now that we're going to see that change. I have a feeling it's not going to take too long, just with the expertise that we've witnessed here today, and the like you said, thought-provoking insights that have come through.
Absolument, absolument. Merci à tous nos illustres experts. C'était réellement un privilège d'avoir pu bénéficier aujourd'hui de votre expertise, de votre savoir. Quelle générosité, en fait, dans votre savoir, du partage. Merci énormément donc d'avoir participé à cette première journée d'une série de 3 jours de discussion donc autour de la thématique de la lutte contre le tabagisme et le développement en Afrique. Coup d'envoi, de 3 jours d'intenses discussions. Alors, nous allons à présent marquer une petite pause avant de passer à notre 4 ateliers du jour qui se tiendront en parallèle. Alors, écoutez bien.
Well, I think it's safe to say, Anne-Marie, that we're not going to be taking any smoke breaks in these workshops.
As soon as I said it,
not in this conference. No smoke breaks, that's for sure. So this should get the work going quicker. Okay, so let me give you some idea here of the different workshops. Let me start with workshop 1. The title there, Tobacco Control Sustainability, the Tobacco Control Funding Landscape and Overcoming Challenges to Establish Tobacco Control Funds. Workshop 2 will focus on generating tailored evidence for tobacco control. Experience sharing as well is what will happen there. Workshop 3, the need for multi-sectoral support for tobacco control at country level. Workshop 4 will focus on building sustainable partnerships in tobacco control. And I think that has already started here, I think, before we even already got on the screen there. So I think there's a lot of work to be done, but it's doable. It's doable. We can do this, everybody.
Absolutely, and some wonderful comments in our chat, notamment de Peter Ouko qui nous dit, il faut vraiment foncer, il faut foncer et relever les défis. J'aime particulièrement ça. Alors, pour suivre donc les indications que nous a données UVK, j'aimerais vous dire qu'une fois que vous aurez quitté cette séance, vous devez retourner vers la page de l'agenda du jour pour y choisir votre atelier. Merci encore une fois de nous avoir suivis aujourd'hui. C'était un véritable privilège et puis on se dit à demain.
Absolutely. It has been an absolute privilege as well. And we'll be back tomorrow morning. Can't get rid of us. We'll be back here tomorrow, and goodbye. Au revoir. From us, or from
Au revoir.
Me.